So for the next baby problem that we'll get to look at, this is what is known as neonatal hypoglycemia. Neonatal hypoglycemia. So neonatal, neo is new, natal is born, all right? So a newborn, hypo is low, glycemia is glucose levels, all right? So in the blood. So you're just simply saying you give birth to a baby and this baby has what? Low glucose. Okay, of course the baby will be weak. Those are the things you should be thinking about. So it just simply refers to low glucose levels in newborns. It typically occurs within the first few days of life. So since glucose is the brain's primary energy source, early detection and treatment are very crucial because it can lead to some nervous system issues. You understand? So why it happens? So after birth, the baby is now coping with the outside world being different from what they were seeing in the world. Uterus, So sometimes the baby is premature. Sometimes the baby has a low weight. Sometimes the baby was born to a mother that had diabetes mellitus, all right, birth stress, okay, going through the birth canal, right, probably it was not really that wide for the baby, delayed feeding, then endocrine or metabolic disorders. So for signs and symptoms, some babies, no symptoms, okay. Maybe you just did some tests, just some general, well-being tests, and you found out. Or some babies, they will tremor, okay. Poor feeding, they're not really responding well to stimulus and all of that. Lethargy, apnea, rapid breathing. Then the skin is bluish, showing that the oxygen supply was not optimal, Then seizures too. So diagnosis is you're just trying to check out for glucose levels. All right. So once glucose levels is below any of this range, you know that the person is hypoglycemic. Treatment is the person lacks glucose, so replace glucose. Okay. So IV dextrose, buccal glucose, glucagon or hydrocortisones. Then keep monitoring. So as you're monitoring as the baby is recovering, okay, you just be knowing how you are replacing that and all.